I chose medicine because I couldn't imagine myself doing anything else. Ever since I was a kid, I used to just think, I want to be a doctor, I want to be a doctor. So it kind of was just like a dream realised almost.
We're a large and really friendly medical school. We have connections and relations to many different hospitals and clinical settings. We're actually physically connected to the RVI in Newcastle, which is a major sort of tertiary care centre in the city centre.
So this is the entrance to the medical school. You can see students coming in and out, whether that's for their lectures or to get some work done at the library.
At Newcastle, the course is case-based. This basically means that every couple of weeks we get a new scenario about a patient. We have lectures, seminars, we spend time in the anatomy lab and in the clinical skills lab.
It's called a spiral curriculum because each case builds on each other. You tend to build on the content from what you've learned before.
Each case starts off with patients coming in and taking a chair right on this floor here. They'll start to talk about their experience of illness and talk about some of the medications they take. And on top of that, they'll actually be prompted by students sitting in those seats behind me to ask questions.
Early clinical exposure really benefits medical students in general at Newcastle because it gets you a lot more comfortable with the environment of patient interaction. So this is Clinical Skills Lab. This is where we are mostly in year 1 and 2, learning how to do clinical skills. So my first thing that I remember doing here was a blood pressure reading. So we're taking blood pressure readings on each other and pulses exams.
At the beginning, it's definitely quite a daunting experience to think that you have to take a history from a patient. You don't want to make any mistakes, but from doing this so early on, you know that it's not something to be fearful of anymore. It's just something that you need to get better at.
I'm at the Walton Library right now. It's exam season, so we have to be a bit quiet. But this is the library where I always go to just get some work in, especially leading up to exams.
A big part of it is the elective as well in 4th year, where you can go anywhere in the world for 8 weeks and get to practice medicine.
At the end of 3rd year and at the end of 4th year, our students get to do what's called a student selected component. In that, they get to choose an area of medicine that they would like to learn a bit more about, become a little bit more specialist in. We've got a programme in Malaysia where students from NewMed can come to the UK and students from UK can go to Malaysia.
I think with medicine it's something that you have to give 110% to, but on situations like in the hospital speaking to patients, that's when you feel like you get 200% back.